for helping me grow my hair back.
From the station working for you, this is WRTV News at 5:30, streaming now.
Now at 5:30, questions about the vaccine. Is it safe for women who are pregnant? A local OBGYN weighs in with important points to consider. And Mount Rushmore is certainly a sight to behold, but one Indiana woman got a little close and is now paying the price. Chris.
Topping our lineup, the latest stimulus package may encourage more companies to help their workers pay off their student loans. How the benefit works, why it may be worth asking your company about it. Also ahead, how improv actors are playing a key role in teaching doctors a skill that some say you just don't learn at medical school. And there's a new tool to keep you informed, not influenced, about politicians, laws, and your rights. We're taking a look at this new educational resource that's launched by a healthcare worker.
First at 5:30 tomorrow, we expect to learn more about Indiana's COVID-19 vaccine distribution plan and the number of people who have been vaccinated so far. That's when the state will provide updated numbers about the vaccine rollout, and the governor and state health commissioner will also hold their weekly coronavirus briefing. So far, healthcare workers, residents of long-term care facilities, and first responders are the only groups that can register to get vaccinated. We spoke with an Ascension St. Vincent OBGYN who says she's heard from many pregnant healthcare workers wondering about how safe is the vaccine for them. Pregnant women were not included in the clinical trials for the Moderna or Pfizer vaccines. But the doctor said that pregnancy puts women in the higher risk category.
We do know that our pregnant moms are at higher risk of severe versions of COVID-19. They're more likely to be hospitalized. They're more likely to go through respiratory failure or require a ventilator. And unfortunately, even at higher risk of death from COVID-19. When the time comes that you are offered the vaccine, you really need to sit down and have a conversation with your obstetric provider about what your personal risks are, what that benefit from the vaccine would be, and to make that personalized decision at that time.
She says the bottom line for pregnant women or women who are considering getting pregnant is this: avoid gatherings, follow guidelines to stay safe, and stop the spread. The Rebound Indiana is our commitment to helping people and businesses get access to the resources that will help them get through the pandemic successfully. The Wayne Township trustee here in Indianapolis is offering a financial boost to small businesses in that township. Small business owners can now apply for the Helping Hand Grant. 30 eligible businesses will be awarded $2,000 that can be used for payroll, taxes, utilities, rent, or mortgage. The deadline to apply is a week from tomorrow, January 13th. Businesses are eligible if they were established in Wayne Township by 2018, have at least 4 employees, and can demonstrate a decrease in revenue due to the pandemic and Marion County's public health orders. You can find a link to apply in this story on the WRTV app. Recipients will be announced January 20th. Kevin.
And Amanda, I've got my eye on the sky. I guess that's my job anyway, but specifically, I'm looking at the cloud cover. More clouds will mean less fog tonight. So let me show you how this may play out. As you look west, it's farther west along the state line where you begin to see kind of a clearing line. I don't know that it'll move that far east, but it does come into western Indiana. Much of the state still with overcast skies, but where the skies are clearing a bit will lead to more fog and dense fog, with temperatures below freezing, something to keep an eye on. 34 in Castleton, 34 in Martinsville. Not much of a temperature range there. The winner in the state as far as mild temperatures, Evansville at 46 degrees. Temperatures by tomorrow morning down to 27. And again, that will come with fog, especially in the western half of the state. Could have some slick spots because of some of those fog droplets freezing. Chris.
The news feed starts with a new lockdown in the UK. This is the 3rd British lockdown of the pandemic. The government there calling for a last national effort to help stop the spread of COVID as the vaccine makes its way into the population. Now, drug prices are rising here in the U.S. Research firm 46 Brooklyn says drug makers raising prices on more than 500 drugs to start the new year. Prices are rising as doctors' visits have declined during the pandemic. Now, as the Trump administration prepares to leave office, the EPA is rolling back just how much it relies on public health studies. Opponents say that those studies are important because they help establish some of our nation's most important clean air protections. Well, the number of COVID cases that we're seeing across the country right now is putting a strain on contact tracing efforts. And that's forcing some health departments to ask people to do their own self-exposure notification.
What health departments are essentially saying is, if you test positive or diagnosed with COVID-19, it's possible that you won't hear from us. We just don't have enough staff to keep up with all the calls that need to be made. So here's what you need to do. We need you to self-isolate. Here are some tips for doing that safely. Think about the people you may have exposed in a certain time period and notify them of their exposure.
Angela Beck is a professor with the University of Michigan, and she says that we've increased the number of contact tracers since the spring, but along with seeing more cases, well, those workers who are primarily short-term were already stretched thin and are now helping with vaccine distribution as well. She says asking people to do their own exposure notification is not the preferred strategy, but it's better than no information. Still, there are things we're missing, not having public health worker involved.
So we miss out on the ability to link community members to needed resources. We miss out on the ability to answer questions about symptom monitoring or quarantine or to calm some fears. And importantly, we miss out on the ability to do complete tracking of virus transmission.
Now, she expects that we're still going to need contact tracers for a while, and you can help ease some of the strain they're facing by following all the public health measures like wearing a mask. Now, more to get to in our lineup. The latest stimulus package may encourage more companies to help their workers pay off their student loans, how the benefit works, why it may be worth asking your company about it.
Your brain, better life.
The new year is starting off right for hundreds of General Motors workers around the country, including dozens here right in Indiana. They're becoming full-time workers. The automaker announced this week that more than 650 temporary hourly employees will become full-time employees starting this month. The job transition is taking place at 9 plants across the country, including Fort Wayne and Bedford. A GM spokesperson told WRTV they are converting about 70 temps in Fort Wayne to full-time and less than 10 in Bedford. The move is part of a 2019 contract agreement with the United Auto Workers Union.
Businesses are getting an extra incentive to help people with their student loans. The latest stimulus package is extending a tax benefit for companies that can offer this assistance. Employers are now allowed to make tax-free contributions up to $5,250 a year towards their employees' student loans. Now, that benefit is set to go until the end of 2025. A student loan expert tells us that he thinks that this eventually could be permanent.
The benefit of making it permanent is there are some employers who are still sitting on the fence with regard to offering this benefit because they don't want to offer the benefit and then have to stop offering it when if Congress doesn't extend it.
In 2019, 8% of companies were offering student loan repayment benefits. That's according to a survey from the Society for Human Resource Management. Now, it has mostly been larger employers so far doing this, and student loan expert Mark Kantrowitz tells us that's because the companies that facilitate these employer benefits get paid per participant. So it's more expensive to offer for a small employer who wouldn't have as many people participating. Now, if your company isn't currently doing this benefit, he says it's at least worth asking about.
If enough employees ask HR to add this benefit, they'll seriously consider adding it because they want to not just address the needs of their employees, but also to show that they care about the same thing that their employees care about.
Federal student loan payments are currently paused through the end of the month, but employers can still make the contribution and it will go entirely to your principal on your loan. Now, still ahead in our lineup, how improv actors are playing a key role in teaching doctors a skill that some say you do not learn at medical school. The news feed starts with an update on the vaccination efforts by the Department of Veterans Affairs. As of this week, the VA says it has vaccinated 14,000 veterans and 132,000 staff members. The VA says it's giving the vaccine to veterans at its long-term care facilities. Now, one of the first members of law enforcement to respond to the Sandy Hook shooting has passed away from COVID-19. Retired Connecticut State Trooper Patrick Dragon died at a Hartford hospital. A Facebook post says that he fought a valiant battle with the virus. A scary reality in Los Angeles County as CNN says the situation is so bad that ambulance crews have been told not to transport patients with little chance of surviving the virus. 1 in 5 people in LA County who are tested for the virus test positive. Well, most states are starting to receive some of the billions of dollars set aside to help Americans pay their rent. This money could help 40 million people who owe back rent. And Alicia Nieves shows us how someone qualifies and which states may get the help first.
In the latest stimulus package, the federal government has paired the new eviction moratorium extension with $25 billion in rental assistance.
These funds can be used to pay back rent or back utility that's owed. It can also assist with forward rent and forward utility payments.
Diane Yantel is with the National Low Income Housing Coalition, which advocated for this kind of funding, but explains the new rental assistance comes with very specific qualifications for renters in need.
They have to be at 80% or below area median income, and localities are required to have a preference for people who are at 50% or below area median income.
In addition to income qualifications, renters also have to prove a risk of becoming homeless without assistance and have to actively search for a rental assistance program in their area, which could vary widely depending on your state.
Early on in the pandemic, there were some funds made available to states and localities to create emergency rental assistance programs. So we've been tracking those programs. At last count, there were about 520 of them across the country. About 30% of those programs have already shut down because the resources have been depleted.
Renters in states and localities where there are existing rental assistance programs still in place, they will have access to the rent relief first, while those in parts of California, Alabama, Georgia, West Virginia, and Tennessee, where programs have closed or never existed, they will have to wait until a new program is created.
So on our website at nlihc.org, we have a map and a database of all the emergency rental assistance programs that exist now. We'll continue to track those, so that might be a good place for viewers to look. They can also call 211.
It's unclear how quickly the $25 billion will run out, but most organizations like Yantel's are almost sure it's not enough, estimating more like $100 billion could be what is needed to get all struggling renters through this pandemic. I'm Alicia Nieves reporting.
An Indiana woman has pled guilty to climbing Mount Rushmore, which is a federal violation. 20-year-old Molly Venderly from Bloomington entered the plea at a hearing in federal court in Rapid City, South Dakota yesterday. Venderly was fined $1,250 after entering her plea. A report from a park ranger says Venderly told him she climbed in the dark Sunday because she knew it was against the law to scale the monument and knew the park was closed. The ranger saw the woman's flashlight on a security camera and found she had made it to the base of George Washington's lapel. Kevin.
How about that? I think the face is about 60 feet from say the chin up. If there's 3 million visitors every year, you're going to have somebody that tries to climb it, right? 34, let's talk about climate in a different way. 34 degrees in Indy now, that wind northwest at around 10 miles per hour. The wind will calm down this evening, setting the stage for some patchy fog. That's part of the recipe. Light wind, moisture, and then getting the sky to clear, which is more likely in the western portion of the state. We'll land in the 20s tomorrow morning. 27 is the way we'll start the day, so any fog around may lead to some slick spots with freezing fog. Temperatures don't really go anywhere tomorrow because, again, the cloud cover wins the tug of war between clouds and sunshine, staying about average for this time of year. Some highlights tomorrow. The wind will stay light. Stays cloudy after the morning fog. Temperatures no warmer than about 38 for the afternoon high. And as I look 7-day forecast, there's not a single day that I have with temperatures above 40. Temperatures colder, Logansport and Marion at 33 tomorrow. From Richmond on over toward Rockville in western Indiana, temperatures within a couple degrees of 38. And that's the game plan in the southern portion of the state as well. What changes Thursday? Not much. We could have some patchy fog again. Temperatures in the 30s. The change will come Friday with even colder temperatures than what you see here. Thursday's highs around the mid-30s. Friday, 33 and dry. That's the coldest day of the week. We'll look toward the weekend when we come back in just a little bit. Chris?
The news feed starts with American Airlines phasing in new rules for emotional support animals. The new government definition of a service animal is a dog that is trained to help people with a disability. The rule goes into effect January 11th. For new travel, American Airlines says starting February 1st, people will need to fill out a form attesting to the dog's behavior, training, and health. Amazon finding ways to get you your packages faster by buying 11 767 airplanes. Amazon actually has a decent amount of planes already, brings the amount they own now to 80. Well, it'd be nice to start 2021 with winning the lottery. Right now, Mega Millions and Powerball's jackpots are more than $400 million each. This is only the third time that both have totaled more than $400 million at the same time. The Mega Millions drawing is tonight. Global warming that has already happened is enough to exceed climate change goals. That's according to a study that's published in the journal Nature Climate Change. Scientists say it's not game over yet. As long as the world stops emitting extra greenhouse gases, the global warming limit could be delayed for centuries. Well, as the COVID vaccine roll out, well, so do the scams. Government officials in the U.S. and Europe say there are emails being sent out promising entry to secret lists for early access to the vaccine. Message boards on the dark web talk about COVID-19 vaccines for sale, and the FBI and Interpol have also found false cures and vaccines on fake websites. After medical school, many doctors say they were never taught how to deliver bad news to patients. Now there's a new training that's using actors to help physicians who might already be stressed out deliver difficult news. Kai Beach shows us what doctors taking the class have to say about it.
This kind of lesion, as we call it, could be a cancerous lesion.
Breaking bad news is never easy.
But, my grandfather had lung cancer.
And as more healthcare options move to virtual platforms during the COVID crisis,
how can I have a tumor if there's no symptoms?
more healthcare workers are exploring new ways to better communicate with their patients.
I've really always been fascinated with communication and the way doctors discuss tragic news.
Dr. Anthony Orsini is the founder of the Breaking Bad News program, a training system developed to help doctors talk to patients more effectively during tragic times.
Sometimes when we get caught up in the everyday tasks of medicine, we forget to convey that compassion.
To help medical professionals express more empathy, this program has doctors working with improv actors to develop the most effective and compassionate ways to deliver bad news.
The good news is in this whole thing that your grandfather didn't have the opportunity to have this early screening.
This program has caught on nationwide, with healthcare leaders saying these practice sessions better prepare doctors to handle difficult dialogue in real life.
Depending on how we react to patients, their response to us is going to be different.
Dr. Tanganyika Barnes is with Inglewood Hospital in New Jersey. Her team recently bought into the online breaking news program, saying it offers something medical schools don't.
I feel that having gone through both, using, improvisational actors, it's a more authentic response.
I didn't think that we thought I had cancer.
Maybelle Lincoln is one of the improv actors helping train physicians to talk to patients.
We know we're part of a culture change, and that's a really good feeling.
She says this program helps doctors recognize that patients are people, while better combining science with socializing.
Studies have shown that the manner in which a physician gives bad news can affect a patient or family up to 30 years after the discussion.
And as doctors become better at breaking bad news, the sooner patients can start the healing process. I'm Kai Beach reporting.
Kai, thank you. And finally in our lineup, there's a new tool to keep you informed, not influenced, about politicians, laws, and your rights. We're taking a look at this new educational resource that was launched by a healthcare worker.
Home store. This is home.
If there's one thing that we can all take away from the election cycle, it's that every vote counts. The more informed you are, the more likely you'll vote.
But a couple of elections ago, I decided, wow, I'm not using my right to vote. So many have given so much so that I have this right, and it's not cool for me to not vote. I need to vote.
Healthcare worker Kelly Reardon decided to become a more responsible voter a few years ago and started trying to research politicians and bills. The problem was she really couldn't find what she was looking for. So she and a friend launched WeWillDecide.com. It's a website that tracks all of the bills and all of the laws that have been voted on, both past and pending.
The biggest feature of the site is being able to vote alongside your representatives, your senators, voting on all the same bills that they vote on, and then getting a calculated percentage of agreement between yourself and not only your representatives, but every single congressperson, every single one.
You can learn other things like bills Congress members have proposed, also just how often and how they vote. The search engine can find specific representatives on topics for guns, abortion, and COVID. Reardon learned some things along the way that she actually found surprising.
I call them fluffy votes. They're feel-good votes. National Cut Flower Day, National Cowboy Day, National Bison Day. I like cut flowers, cowboys, and bison. Does that need to go to the floor?
Well, she also learned that there are some votes that are not recorded, like voice votes and unanimous votes. Now, WeWillDecide.com is free to join right now. They have no ads to stay neutral. After President's Day, though, that's in February, they will be adding a small monthly fee, which you can actually not have to pay if you end up referring people to sign up. Now, we're helping you stand out in your job search as we start the new year. Tomorrow, we have advice from a recruiter that includes why applying through a general job seeker website may not land you that new position.
I don't want to pick your hopes up. I'll just come right out with it. There's no big warm-up in the 7-day forecast, but there is some sunshine. We'll have to get to the end of the week and into the weekend, but look what happens. Mixture of clouds and sunshine Saturday and Sunday. Temperature still on the cool side, though, in the middle 30s.